things trauma, autism, and ADHD in my new series, I Am Making Lunch. I thought we'd talk about some current research. My new vibe is to be doing that. So I found this interesting article about the female phenotype of autism, and actually it being discovered or written about 2 decades before Kanner and Asperger, if you know, you know, first wrote about it, from a Russian child psychiatrist. Now, the article was published in the Italian Journal of Psychiatry, and it talks about this woman. Her name was Grunya Sukareva. I have no idea if that's probably not correct how to pronounce her name, but how she wrote about these 5 different cases of the female phenotype of autism. And because her work remained untranslated even until the 1960s, and again, I think finally in 2020, and even when it was translated, it was only translated around her male interpretations of the male typical profile of ASD. And so this article is talking about how what she described so long ago, she was born in 1891, how that really aligns with what we're beginning to talk about more and more when it comes to the female phenotype, and how much differently, it sounded weird, females can present in terms of autism, and why that's so important so we can get identified and supported if we want to and need to and things like that. So the second part of the article that was later translated that they kind of ignored around the females was basically talking about clinical cases of females with autism in what she described as schizoid psychopathology. Now, a quick reminder that the schizoid personality disorder is this. I'm going to read it to you really quickly, and it's from Neurodivergent Insights, which I love. But think about how we talk about how part of autism can be us being loners and isolators and the social piece, right? Though not true for everyone. There are people who are on the spectrum who love to socialize, but it seems like the depletion and the exertion of socializing from the, no socializing to enjoying it, or like the hyper-empathic connected part, still takes a big toll. But it says this: schizoid PD is characterized by detachment and indifference to social relationships, interactions, and engagement. Such folks have limited social interest and may have little interest in intimacy issues as well. Others may describe them as loner or isolated. However, this does not cause them distress or pain. Now, when this was finally translated, we're talking about aligning this with what we see in the DSM-5 TR, talking about the female phenotype. And so just kind of quoting that, this is what the DSM says. Below is a quote: girls without intellectual impairments or language delays may go unrecognized, perhaps because of subtler manifestations of social and communication difficulties. In comparison with males with ASD, females may be more likely to have better reciprocal communication difficulties. So subtler, I guess what I'm trying to say is a subtler manifestation of communication difficulties. In comparison with males with ASD, females may have better reciprocal conversation and be more likely to share interests, to integrate verbal and nonverbal behavior, and to modify their behavior by situation, despite having similar social understanding difficulties as males. Using my daughter's homemade green goddess lesson. Okay, so it says attempting to hide or mask autistic behaviors, for example, by copying the dress of someone, voice, and manner of other socially successful females or women, or those who identify, may result in an underdiagnosis of ASD for some females. Repetitive behaviors may be somewhat less evident in females than in males on average, and special interests may have a more social, like singer, actor, thing like that, horses, normative focus, while remaining unusual in the intensity. In summary, females with ASD are believed to exhibit better social skills, especially through the use of compensation mechanisms based on imitations. Remember, compensation, all those pieces of camouflaging, right? We're looking around, we're copying others, we're imitating, we're masking to fit in. This phenomenon is usually called social camouflaging. And so blah, blah, blah. Then it talks about how these are often conscious and unconscious behaviors and attitudes that it says this: the conscious and unconscious imitation of behaviors and attitudes of those considered socially successful with autism allows an individual to adopt a non-autistic lifestyle and or mask the evidence of their social difficulties. Gender-specific studies have found that individuals assigned female at birth, self-identifying as female, or non-binary individuals enjoy more frequent and pervasive camouflaging strategies extending across various life situations compared to those employed by males. So we all kind of know that, right? That's the whole masking thing. What's interesting, though, is that the study starts to talk about what the psychiatrist wrote about that basically matches this. And also they talk about the cost, the price. It says the daily use of coping strategies comes at a cost in the life of someone with ASD. It represents a constant effort, a daily expenditure of mental resources in every social situation encountered. I just posted a quote from Rudy Simone's book on female autism saying that every social interaction for a person on the spectrum can often have this element of fight or flight initially, like just the idea of social contact. Nothing is relaxing. Everything must be managed, controlled, and monitored in the smallest details to prevent the mask from slipping during a moment of distraction. Additionally, there is a significant suffering we can experience arising from the dissonance between the perceived self, deemed unacceptable by others and thus concealed, and the presented self, experienced as inauthentic and alien. So it's not surprising that we have higher levels of depression, self-wounding, social phobia, anxiety, and overall psychological distress. And so then it says, we have delved into the description of camouflaging because we believe that some features of the female autism spectrum, as outlined by Sukareva, the Russian psychiatrist, can be interpreted in light of this coping mechanism. According to the author, the main female characteristics, this was back in the early 1900s, the main female characteristics of schizoid psychopathology considered to be an equivalent to the contemporary autism spectrum, so same, include greater emotional ambivalence, mood instability, and negativism, along with less pronounced motor deficits, so less obvious motor deficits, right? That's part of why we don't get recognized, even physically looking the same. Regarding emotional ambivalence and mood fluctuations, I'm gonna have some potatoes too. Sukareva reports that compared to males, females tend to alternate conflicting emotions, rapidly shifting between phases of mood stability with context-appropriate behaviors and moments of emotional dysregulation. A picture of isolated sensitive spots against a backdrop of general emotional flatness. That's what she's talking about there. These are so good. They have lemon, oregano, garlic powder, onion powder, olive oil, and Parmesan. Okay, interestingly, we can infer from the cases presented back in the day, this alternation tends to diminish with the subject's growth. Basically, over time, the girls get gentler and calmer, so they become more masterful at masking and reading and presenting. We could hypothesize that the observed emotional ambivalence in these girls reflects the gradual learning of camouflaging strategies. And so it's just interesting to talk about that the mood dysregulation, the mood swings, the negativism really manifests and looks a lot like borderline. And this article talks about how frequently borderline has been diagnosed in those females who identify as female, in those who are actually autistic, and that it is so common, and that these diagnoses are often given to patients with ASD or sub-threshold autistic traits, especially when you have, ding, 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 trauma. Well, we know we have trauma with autism, we have trauma with borderline, we have trauma with almost everything, basically. I'm not even laughing, it's not even a joke, but like it's everywhere. And so that notably, they're gonna see trauma, they're gonna see these schizoid personalities or dynamics, and they've historically labeled them as borderline. So what does all that mean? It means that for a very long time, this presentation has been there since the beginning, but not been seen and been often misdiagnosed as borderline or dismissed. And it's an important part of our evolution to understand what it looks like.